So the couple folks that I invited to come out, first off, Maria Stahl, the administrator for the Florida Department of Health here in Brevard. If you want to come on up, I'm happy to give you as long as you need.
Good afternoon, Commissioners. I thought I would just go through and give an update as to the current state of affairs here in Brevard County. Right now, we truly do have community spread with our cases. And these numbers are from the 6 o'clock release last night. Right before I came over here, the release was not there. The state does their releases between 6 and 7 p.m. and 11 to 12 a.m. And the 11 to 12 a.m. was not released right before I came, so it might be a few cases higher. We have had 32 cases. Out of those 32 cases, 28 of them were residents. So that means 4 cases are here in our county that are not residents of our county. We have 5 that are currently in the hospital. Out of the 5 that are in the hospital, 3 are on ventilators. So, and that is spread out amongst our hospitals. We've had 9 cases out of the 32 that are not related to travel or a case. So that's why we are now classifying the community spread. To talk a little bit on testing, the numbers that are showing on the state dashboard is a little misleading. The numbers that are showing on the dashboard, which is 555, I think it was last night, are only showing the cases that are going up to the state lab. So the cases going up to the state lab could be from us and it could be from the hospitals, but those are the ones going to the state lab. They are not reporting out those going to the private lab, which is LabCorp request, just as a state as a whole. And the state as a whole, there's about 5 times the amount going to the private labs than the state labs. So based on that, I would estimate between 2,000 and 2,500 labs are going to LabCorp and Quest. We do not know the cases that are going to LabCorp and Quest, but as I say that, any positive case from LabCorp, Quest, or state lab do get reported back in our state system.
So Maria, with respect to that, I apologize for interjecting. So the number of positives that you show on your dashboard, just to make sure we're on the same page, that's correct across all of the labs that are testing, whether
Correct.
It's private or whether it's state-based? But the number of tests that are shown as having been run on your DOH or your FDOH dashboard, that's just the state lab. So
Correct.
Predominantly DOH and then whatever hospitals may send up there as well.
Correct. Every positive lab gets reported back to us. So the positive cases are everything.
So it may make the numbers of positive, I should say the percentage of positive, look artificially high if they don't show a corresponding number of individuals that were tested then.
Correct.
Thank you.
What is being shown statewide is there is, on any given day, a 7 to 13% positivity rate amongst all the labs. The state lab for Brevard County specifically is showing a 5% positivity rate. So the other thing is the first case was identified on March 17th. The second case was March 22nd. And we are seeing a doubling of cases every 2 to 3 days since then. So just to kind of give a perspective there of what's going on. Specifically talking on the testing, we are following Department of Health. You know, we are one of 67 counties, a part of Department of Health. We are following Department of Health guidelines, who is following CDC guidelines. However, there's sometimes a delay, 1 or 2 days, but we are following Department of Health guidelines. New guidelines were released from Department of Health this weekend, okay? And to spell them out, priority 1 testing. Priority 1 testing is for hospital patients or hospital workers with symptoms, okay? Primarily, that priority 1 testing is being done by the hospitals because they're there. Priority 2 testing is patients in long-term care facilities with symptoms, patients 65 years of age or older with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. That's primarily the ones that we are doing through our drive-through collection sites at our clinics. Priority 3 says, as resources allow, and depending on what's going on in the community, priority 3 is critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, individuals with mild symptoms, and communities experiencing high number of COVID-19 hospitalizations, which we are not at that point. However, anyone that is now calling us starting yesterday that meets the priority 3, if they need to call their doctor first or try to get to an urgent care. If they cannot get tested from one of those places, but they do have a prescription from a doctor, we will test them. Okay? As I say that, is beginning of this week, end of last week, one day meshes into the other, I'm sorry. But we did start our testing at our clinics. It is not busy. We have capacity for testing. So just as I say that. The counties that are doing the mass collection sites, they are either FEMA, hospital, or privately run. The health departments may be helping a little bit, but it's one of those 3. Okay. Over this weekend, they did, FDA did get approval for a rapid test kit, which is the first, which is actually very promising. The state is receiving some, and they're allocating them as they feel they should be allocated. I don't know where, we haven't heard specifically where, but probably more towards South Florida where they really do have a lot of cases. So as we move forward, I think the important thing is to continue our messaging, which is social distancing, 6 feet, no crowds more than 10, wash your hands all the time, cover your mouth when you cough or sneeze, stay home if you're sick, go home if you're sick. So that's the big messaging. The other thing I did want to mention is the state is mobilizing EMS teams to go into all of our long-term care facilities and just do frontline inspections and make sure they are adhering to no visitors, wearing masks, no congregate dining, just to make sure that is happening. And then if they find violations, it'll come to us, to go from there. So the other thing, we are working with emergency management, with Kim and Matt, on hospital surge plans, so where they need to go. So that really is what is going on right now, which some of the same of what you heard, but if you have any questions, please feel free to ask.
Commissioner Pritchett?
I got one for you. I was intrigued last night with the presidential address, and they were talking about hopefully soon having the test to run antibodies to see who's already got the antibodies for this.
Yeah.
Do you know do you have any anticipation of when it might hit the community that we can start doing that?
I do not, but I can keep you, we do have daily DOH calls, so if that comes about, I will
Okay, I'm
let you
very
know.
interested in that if you get information.
To jump in, and I would ask if you don't mind helping me out with this one as well, Maria. My understanding, and Maria sent me some more info because we spoke about that some days ago, over cross-reactivity on the antibody kits. So the issue is with them testing IgE and IgM antibodies, there is a degree of cross-reactivity between other coronavirus strains and this. So even if you do show an antibody response to this coronavirus, this particular one, it doesn't necessarily mean that you've been exposed or infected by that. You could have been infected by a similar virus that's been out and about for long enough that you picked it up some other way.
Right, but
So
I'm guessing as you keep working, they're going to be able to define that a little stronger.
Right.
So
And
that,
even this rapid test, I was reading a little more in depth on it this morning. This rapid test, a positive is a positive. A negative isn't necessarily a negative.
right.
So, that's, yeah.
my understanding with it, and again, this is someone that had dengue years ago and had the phlebotomist basically pull a Dracula on me, testing me for everything under the sun. But they will, once they get that, if they do have an ability to genetically test through PCR, as is the case with this, it's there if you have the genetic material showing that it's that particular virus. So there is no false negative or false positive. Well, I should say there's no false positive with respect to that. but the antibody tests, they're certainly much better than nothing, and I think, maybe the way that FDOH will be going, depending on numbers and availability, would be to do initial screening with that if we still have an issue with respect to running enough PCR kits, to determine who really ought to get the PCR testing, because if they come back positive IgG or IgM, then maybe it's worth going ahead and testing them for PCR,
Right.
which would be more in-depth and more expensive and apparently less available. So I don't know if that's the way that the thought process is going. Or
Yeah, I can tell you that everything is changing on a daily basis. Just as Commissioner Pritchard said, the president said last night, but everything is coming down very rapidly and changing very rapidly. So I'll keep you informed.
I appreciate you coming out as well.
Mr. Chair, can I also, I know
Please.
Commissioner Dr. Isnardi's on the line. I would just like to throw out to her that as she gets information on this, because she's probably on top of it, that she would throw it in our direction too. Ma'am, is that good?
Commissioner Snarty?
I'm good.
Okay.
Yeah, and if anyone has someone either in epidemiology or infectious diseases that they want to come in, and it's not to conflict with Maria, but to supplement anything or to add a different take on things, let me know, and I'm happy to invite them on behalf of the
Yeah.
commission to come out. I don't have any issue with that.
Yeah, the other thing I'll mention is in Brevard County here, we've been very fortunate to have a very good response from our private partners, our urgent cares. We have hospitals that are hooking up specifically with testing sites of their own. So when they do go to those urgent cares or they do go to, their private facilities, they are going to LabCorp and Quest. So, that's why when everybody is saying our numbers aren't there, I think our numbers are, they're just not showing through the state lab.
I appreciate that. And one of the things that we addressed yesterday at the Sheriff's Facebook Live broadcast, I guess you'd term it, was the fact that we have at least one or two hospitals locally that are setting up tents outside. I think some folks maybe heard an urban legend that that's because we're running out of beds. But as I've understood, the reason for that, at least locally here in the center part of the county, is because they want to triage folks outside so they can determine where to send them and keep people separate. I've not heard that at this juncture we're at any risk of running out of beds themselves. Does that match your understanding, Maria?
That is matching my understanding, absolutely. And you're absolutely correct with the tents. We even have it outside of our clinics where we're screening people before they come into our clinics.
Perfect.
So,
I appreciate it. Thanks so much again. You've been great to work with.
okay. Thank you. You
Thank you.
too.